sleep though because I'm cold.
You cold? Good.
Turn it on colder. All right, so treatment of gum disease, coronal polishing, and preventive dentistry, and oral hygiene. So scaling means that we go down and remove tartar and stuff from underneath the gums. Prophylaxis and polishing is just up above the gum line. Okay, so a patient comes in every 6 months for a prophy and polish. Okay, usually the tartar is up above the gum line. Anything, whenever we have tartar down below the gum lines, 3 millimeters or so, then we probably will do a scaling. Because one, the patient won't allow us to go down there because they're going to be tender if they're so inflamed. Some patients will allow us, but some patients won't, so we have to numb them up. So the procedure is performed by a dentist or a dental hygienist. The dental assistant's duties include instrument transfer, rinsing of the cavity, evacuation with the high volume evacuator, removing debris from the instruments, retraction, and keeping the patient comfortable. And now with this thing that we got, we probably will put them in the hygiene rooms because it's going to make it easy for the hygiene patients. The hygienist is usually having to deal with all that. You put that in there, I think it's going to work. So again, you need the basic stuff, basic setup: mouth mirror, explorer, cotton pliers, saliva ejector. So just the basic thing. Ultrasonic scaler, we'll show you what that is. Curettes, those are the instruments, special instruments for the scaling, floss, angle, prophy paste. We're going to examine the oral cavity. Let's see. And determine which of the instruments we're going to use. After we remove the calculus debris and stain, then we're going to polish. And we floss. If the patient's periodontal evaluation results in generalized periodontal probe depths of over 4 millimeters, the dentist may recommend a scaling and root planing. The procedure involves scaling the root surface using ultrasonic and hand scalers to achieve a patient comfort. Local anesthesia we have to use in order to keep the patient comfortable. We will normally split up the procedure into 2 different visits. So again, depending on how much tartar they have and how deep it is when we do a scaling. We've seen that picture. Okay, coronal polishing. So what is coronal polishing? The process of removing stained and soft deposits from clinical crown of a tooth. Stained and soft deposits from the clinical crown of the tooth. Not hard deposits, soft deposits. And this is what you guys can do if you get your certificate. Paste or abrasive you use, rotary dental handpiece, rubber polishing cup, and dental floss. The definition of a clinical crown is the portion of the tooth that's exposed. Okay, so the clinical crown is that you can see in the mouth. The definition of a prophylaxis or a cleaning: the complete removal of plaque, stain, calculus, and other debris from the teeth. Calculus is the tartar, the calcified debris that stayed in the tooth that was plaque that was never removed, and over time it calcified. Usually it's on the gum line or above, but the longer it stays, it'll start traveling down the root and cause problems. In order to remove plaque or tartar from underneath the gum line, you need to be a hygienist or a dentist. As an assistant, you cannot go below the gum line. So you can.
Only superficial.
Only polishing, again, up above the gum line.
And sometimes some patients have a little bit of tartar buildup above the gum line, and that's okay. But not below the gum line.
Who may perform the polishing in most states? A licensed dentist or a hygienist. A dental assistant who holds a certificate for coronal polishing are permitted to perform coronal polishing. Okay, so above the gum line, not permitted, below. Oh, backwards. prophylaxis, aka cleaning, the removal of stains, plaque, foreign material, and calculus. Prophylaxis appointment, the hygiene instructions. We do take radiographs so that we can see where everything is, and at the end we do give the patient, kids will normally give fluoride unless the mom doesn't want it, but it is included in the child prophylaxis. In adults, again, patients only if they want it. Because insurance doesn't cover it for adult patients, they do cover it for child. So patients have to decide if they want it. And we'll give them instructions on any nutrition. If they're having a lot of issues, they're drinking a lot of Mountain Dew during the day, not good. So, again, give them instructions on what to do, how to brush properly. Does anybody know the proper way of brushing?
Small circles on the gum line.
Angled 45 degrees. And we'll kind of go over it today. Okay, because those are some of the stuff that by the end of the appointment, when the doctor goes, we'll say go ahead and give them oral instructions. Oral hygiene instructions is kind of brushing 45 degrees angles up into the gum in little circles, and you stay on 2 or 3 teeth, and you slide over 2 or 3 teeth, and you just keep going. Okay, you don't scrub on the gum line. You scrub on the biting surface, but not on the gum line. Again, preventive dentistry. Benefits of coronal polishing: you remove stain. Complete removal of debris may allow fluoride to penetrate more effectively. Your teeth are the cleanest as soon as we finish the polishing. That's the cleanest they'll ever be. A few seconds after you finish, the pellicle starts forming on your teeth, which is that sticky stuff. So when you do the polishing and you apply fluoride, that's when you're going to get the most benefit off of the fluoride, because that's when the tooth is open to whatever you're going to give it. Again, it's going to help in preparation phase for dental and restorative placement. We'll put patients, especially that have root decay, on fluoride. Drawbacks: it could increase tooth sensitivity, especially if a patient has a lot of gum recession. You want to be careful not to use a really abrasive polishing, because you can cause some sensitivity down by the roots. Be careful where you're polishing. If it doesn't need to be polished, don't polish. Stay up where the stains are. They dull the surface of dental restorations, and this you sometimes can't avoid, especially if they have a real big filling in the front that's a composite, and you get in there with an abrasive, you're going to scratch that, so they're going to lose the polish on that. So try to stay away. If you notice that they have that, stay away from it. On baby teeth, newly erupted teeth, they say stay away from it because the enamel is recently erupted, and you can lose some enamel. I don't know about that, but depends on who you read. I just don't apply too much pressure. Don't use a really abrasive toothpaste. Selective polishing. This sometimes, again, depending on if some dentists only like to polish teeth that need polishing. Like if there's stain on a tooth, they'll polish it. If there's no stain, they won't polish it. If there's exposed root surface, they won't polish it. They'll only polish the top. So again, it depends on what your philosophy is. Some believe that you only polish what you need to, because there's a small amount of enamel that's lost, or tooth structure that's lost when you polish. I guess if you went in there and measured it, I guess there is technically, but over a period of years, it's probably minimal. So again, sometimes they only polish what has a stain. I polish everything. Infection control. Yes, we know. If you are doing coronal polishing, you need to make sure that you're going to be wearing your masks, because you are spinning around in the saliva, you're going to get an aerosol. You want to be protecting yourself, and we've gone over that before. So just make sure you're wearing your PPEs. It talks a little bit about what diseases you can get or pathogens that you can get. So again, TB, hepatitis B, hepatitis C, HIV. Protect yourself using PPEs. Prevent cross-contamination. We've gone over that. So what are the steps? The assistant should explain to the patient what you're going to be doing. Put on your PPEs, survey the oral cavity, see where the stain is, see where existing, this is a big one, see where there's existing restorations and where there isn't, see where there's cementum. And sometimes, you know, before you go in and you see that there's a missing filling on a tooth in the back, make sure you point that out. Oh, Miss Smith, I see you're missing a filling back here. Because sometimes you'll go in there and clean or do whatever and then say, oh, I don't feel a filling back here. And if you didn't tell them or didn't notice it, you pull down my filling. And guess what? You're going to be doing a free filling. So if you see a broken tooth or they're missing a filling, you say, oh, Miss Smith, you're missing a filling or this filling hasn't been done. You know, we need to do it sometime. So just so she doesn't say, you know, oh, I wasn't missing a filling there and you cleaned my teeth and now I'm missing a filling. So again, point out anything that's missing or damaged or chipped. Select the fine grit. I think we've only got medium and coarse here. I'm not sure if we have fine. You can place Vaseline on the patient's lips, especially if they're really dry. Anybody know what this disclosing solution is? Yeah, you do. You guys.
It's
Borax.
try it.
It's close. That's sodium hypochlorite.
Okay.
That's the irrigant.
I was just trying to answer you.
No, that's fine. That's fine.
Better
This-
than a blank answer.
That's right. Disclosing solution are those red tablets, or that red liquid that you swish and it paints your teeth black red. You guys have never had it in school? Elementary?
Yeah.
In elementary they have you swish and spit. And then,
Make you see where all the black.
yeah. So that's what disclosing solution is. So sometimes you can do that before the patient, before you clean. And that identifies where it's at. You put your abrasive on the cup and you start going around the teeth. The fulcrum is your rest, and that's key when you're doing a prophy or anything in the mouth or any instrument. You got to have a good fulcrum. You grab it with a modified pen grasp. Control the speed. Okay, if you go in there too fast and there's saliva, you're going to spin that saliva right out into your face. So you want to have a controlled speed on the handpiece. We'll go over how to do it. See, dental plaque. Product of the accumulation of bacteria and saliva with a soft, sticky consistency. Plaque contributes to the development of tooth decay and periodontal disease. Formation of plaque occurs in 4 stages. Again, as soon as you clean, you start to get that pellicle, which is kind of like the sticky medium where everything sticks to. Pellicle, and then microorganisms that inhabit the oral cavity adhere to the pellicle. Bacteria multiply and form clusters of bacteria. After 3 weeks, a developed mass of microorganism is complete. For some reason, this rings a bell. I do.
Plaque formation stages.
There you go.
So
you acquire-
We'll have a little starter.
Just right there, yeah.
So,
Or remember what's on the test numbers, yeah, so the stages acquire the pellicle, microorganisms attach, they multiply, and in about 3 weeks they form a complete organism. Okay, plaque and tooth decay, Streptococcus mutans, that's just one of the bacteria that causes it. Acids are produced as waste byproducts of carbohydrate consumption, decalcification, acids removed. Plaque thickens. Lactobacillus is the other bacteria. You guys don't really. Plaque and periodontal disease, the greatest accumulation of plaque occurs at the cervical third of the tooth at the gingival margin. Okay, that's usually where you see it. And those pictures from the gingivitis, where was the plaque? Right at the gum line, the gingival third. Everybody always rushes up on top, but you got to tell them that's why we angle it 45 degrees into that margin. Role of the diet in preventive dentistry. Vitamin A, C, D, and the minerals, fluoride, and calcium are important during growth and development. Drink your vitamins. Food that promotes caries development and periodontal disease. Kind of common sense. Sticky and soft foods. Foods lacking fiber. Sugary foods. What's fluoride? Fluoride is good. Reduces tooth decay and periodontal disease at all stages, not just kids. Why insurances don't play fluoride for adult patients, I don't know. They don't. But again, right after the prophy, you apply fluoride, and that's when it's going to do the most good. And most everybody gets fluoride through the water. Not so much nowadays because everybody drinks bottled water. But as a kid, usually you get your fluoride one way or another. Systemic fluoride, when ingested systemically, fluoride causes the crystal structure of enamel to be more resistant to acids, and that boosts bacteria. Okay, so there's different types of fluoride, not really important. There's 2% aqueous solution, there's 8% aqueous solution, and acidulated phosphate, APF. This one, we normally tell patients that do have a high caries index, we either tell them, if on kids, usually we have them use ACT fluoride rinse, so they brush, floss, and use ACT over the counter. On adult patients or kids that have a lot, then we may give them a prescription called Preventive or Gelcam, and tell them to use that. It does help, but they have to use it. Dentifrice is another generic name for toothpaste. Usually your toothpaste has fluoride, so you are applying topical fluoride, but you do have to keep it on the teeth. That's why you want to brush for 2 minutes, because the fluoride needs to stay on there. Plus, you need to do a good job brushing. But it adds flavor. That's why toothpaste, they add flavor, because if you just try brushing with water, it doesn't taste very good. So people are more compliant if they brush with something they like. So that's why they add flavors. And now, I mean, there's so much marketing now that they add all kinds of things for bleaching and dental floss. The toothbrush can only effectively clean the facial buccal lingual surface of the teeth, but it does not get in between the teeth. Flossing should occur at least once per day prior to toothbrushing. Prior or after, I don't care. Ideally, it's before, but you just need to get in there and break those colonies up of plaque. This order is preferred so that an interproximal plaque will be removed prior to brushing and allow the fluoride from the toothpaste to make contact with interproximal surfaces of the teeth. Again, we talked about fluoride. It's best used when it's a clean tooth. So if you go in there with fluoride, with your floss before, clean it out, and then brush, then the fluoride allows it to penetrate into those areas between the teeth. And between the teeth is usually where most of the cavities start, usually. Couple things that here. Floss threader. These are just things that you can use to help patients clean around teeth a little bit better. Okay, so you use a floss threader. It's just like a needle. You're just going to go underneath, thread the floss underneath the bridge. A stimulent is just a little instrument to stimulate the gum tissue. A rubber tip stimulator is kind of the same thing. Disclosing solution we talked about. So here's the floss threader. It's just like a little needle. You thread the floss through there and you just run it underneath.
That's usually used for like braces.
For braces, yeah, or bridges. And this gingiva stimulator or stimulent, that's another floss threader. You can use that floss threader to go underneath frications. Okay, you thread it through here and run it underneath, kind of floss underneath that bridge, or underneath the bridge here. There's a disclosing solution, and so some patients say, I brushed. They come in and you can see the plaque, but they can't see it because it's tooth colored. So they do this and they go, wow. So that's why when you have them rinse before they brush and then have them brush everything off. So they know how long it takes to brush all that off. It's not, 15 seconds. Again, these are perioaids. These are called proxy brushes, and again, you just use them. They're like little pipe cleaners to go between teeth, underneath implants or bridges. Here's a bridge. There's all kinds of stuff. This one has a little. You fill it up with some solution, Paradex or mouthwash, and it kind of you squeeze it, and you can put medicine underneath. This is an end tough brush to get around the back of molars. Some of these things you'll hear the dentist recommending, and we'll draw a picture because we can't have everything to give away. We give a toothbrush, but we'll recommend some of these other stuff and draw it and say you need to go get this and try to use it. At $2 a pop, and you're giving an end tough brush, a brush, a floss, and you end up giving away $5 at the end of the appointment there. All right, so we'll take the quiz. This is when you come back, so we can go to lunch. We'll run over there a little bit, and then we'll break up into our.
Project. Being prepared.